Moving on from that now, nurses across the world are manning the front lines, fighting COVID-19. Since the onset of the pandemic, healthcare staff across the world have put their duties before anything else. But having carried on the battle for this long, the nurses are also suffering now a burnout. The International Council for Nurses has come out in support of COVID warriors suffering psychological distress. As per the ICN, nurses face abuse and discrimination outside of work. The supply of PPE kits for nurses remains insufficient. On the occasion of World Health Day, this is what the chief executive of the council said.
We're extremely concerned about the mental health impacts on nurses. Our most recent survey of national nursing associations showed that more than 70% of them were saying that nurses have been subject to violence or discrimination. And as a result of that, they're very concerned about extreme cases of psychological distress and mental health pressures.
The figures quoted by Catton were based on responses collected from nurses in more than 10 countries. Catton added that nurses face a broad spectrum of issues that affect their mental health, including physical and verbal abuse.
There are nurses who have been subject to discrimination where their landlord hasn't renewed their lease for their apartment, or they can't get childcare for their children.
Nurses have been working day in and out. Howard says that in the last few months, they saw more deaths than they normally would.
In the workplace, there are nurses who have been working day after day after day under intense pressure, seeing more people die than they normally do, having to step into the shoes of the relatives of those people, often perhaps being the last hand or the last face that a dying patient has seen, and are experiencing burnout.
ICN has lobbied for better protection and working conditions for nurses on the front lines of the pandemic. Last week, the WHO spoke about the emotional and psychological distress caused by the pandemic. They said that services for the mental health services across the world are disrupted, and this is likely to worsen.